America's Fittest Cities 2025. Where does Boston rank? Imagine if your city's fitness level was ranked like a sports team's performance. Where would yours stand? In the latest evaluation, Boston didn't crack the top 10 in America's Fittest Cities, but it still managed to shine in a surprising way. Let's dive into the details of the 2025 ACSM American Fitness Index, released on July 22, 2025, by the American College of Sports Medicine and Elevance Health Foundation. This annual study scrutinizes the 100 most populous U.S. cities across 35 health indicators, including new categories like tennis and pickleball courts, splash pads, and trail miles. Arlington, Virginia, once again took the top spot, marking its 8th consecutive year as the nation's fittest city. Following closely behind were Washington, D.C., Seattle, San Francisco, and Denver, Colorado. On the flip side, Oklahoma City, Lubbock, Texas, Las Vegas, Memphis, Tennessee, and Wichita, Kansas, brought up the rear. Among Massachusetts cities, only Boston made the list, securing the 13th position. So, which cities boast the healthiest lifestyles and the most active populations? Here are the top 10. 1. Arlington, Virginia. 2. Washington, D.C. 3. Seattle, Washington. 4. San Francisco, California. 5. Denver, Colorado. 6. Minneapolis, Minnesota. 7. Madison, Wisconsin. 8. Atlanta, Georgia. 9. Sacramento, California. 10. San Diego, California. While Boston didn't make it to the top 10, it shone brightly in one category: the number of splash pads per 100,000 residents. Boston led with 12.6 splash pads, followed closely by Cleveland, Ohio, with 12.4. Here's a closer look at the top 10 cities for splash pads. 1. Boston, Massachusetts, 12.6. 2. Cleveland, Ohio, 12.4. 3. Pittsburgh, Pennsylvania, 9.8. 4. Chicago, Illinois, 8.9. 5. Tulsa, Oklahoma, 8.4. 6. Spokane, Washington, 8.2. 7. New York, 6.8. 8. Philadelphia, Pennsylvania, 6.7. 9. Louisville, Kentucky, 6.2. 10. Henderson, Nevada, 5.9. The good news is that the nation is making strides in meeting aerobic exercise guidelines. According to the CDC, adults should aim for at least 150 minutes of moderate-intensity aerobic activity each week, such as brisk walking, cycling, or lawn mowing, and incorporate muscle-strengthening exercises like weightlifting or push-ups at least twice a week. The 2025 report revealed that 59.9% of Americans met or exceeded these aerobic activity recommendations, up 9 percentage points from the previous year. 94 of the 100 largest U.S. cities saw improvements in aerobic activity. The report attributes these gains to declining smoking rates and increased investment in park facilities. But here's where it gets controversial. Could there be a downside to focusing so heavily on splash pads and sports facilities? Some might argue that while these amenities are great, they don't address broader issues like access to healthy food options and mental health resources. What do you think? Should cities prioritize more splash pads and sports facilities, or should they invest in other areas of public health? Share your thoughts in the comments. Too legit to quit. Arlington and DC dominate the ACSM Fitness Index 2025. Here's a truth bomb. Some cities are so obsessed with fitness, they're making the rest of us look lazy. Arlington, Virginia, and Washington, D.C. just snagged the top spots in the American College of Sports Medicine's 2025 Fitness Index for the 8th year running. Yes, you read that right. 8 years of reigning supreme. Dr. Stella Volpe, former ACSM president, calls it a remarkable feat that proves consistency is key. But here's the twist. Their dominance isn't just about money, though having deep pockets helps. The rankings weigh 35 metrics, including 2 newbies: trail miles per 100,000 residents. DC crushed this with 235 miles, leaving Irvine, California, in the dust at 187, and splash pads for hot summer days. Arlington also ranked 6th in tennis pickleball courts, combining the two sports for a fun twist. Volpe warns, however, that wealth alone doesn't guarantee a high score. Throwing money at parks isn't enough if communities don't prioritize activity, she notes. Seattle, San Francisco, and Denver round out the top 5, but nationally, 3 red flags emerged. Worsening air quality, thanks to wildfires, soaring food insecurity, 99 out of 100 cities saw increases post-COVID programs, and fewer people reporting excellent health. The big question: can cities stay fit if basic needs like clean air and food are slipping? Sound off. Do financial resources always equal healthier habits? Or is there another piece to the puzzle? How healthy is your city? Fitness, food, and pollution rankings revealed. How healthy is your city? Insights from the 2025 report on fitness, nutrition, and pollution reveal a mixed picture. Is your city thriving in health? The encouraging news is that more Americans are engaging in physical activities like brisk walking, playing pickleball, or lifting weights. However, the latest ACSM American Fitness Index, released on July 22, highlights some concerning trends. Air quality is declining, and an increasing number of individuals are finding it difficult to afford nutritious food. This annual report, produced by the American College of Sports Medicine, ACSM, in collaboration with the Elevance Health Foundation, evaluates the health of the 100 most populous cities in the United States based on various personal and community health indicators. This year, the report assessed 35 different metrics, introducing new categories that include the availability of trail miles, splash pads, and courts for tennis and pickleball. For the 8th consecutive year, Arlington, Virginia, has been recognized as the fittest city in the nation, with Washington, D.C., just across the Potomac River, taking the 2nd spot. Seattle, San Francisco, and Denver complete the top 5 list of the fittest cities. On the other end of the spectrum, Oklahoma City ranked last, with Lubbock, Texas, North Las Vegas, Memphis, Tennessee, and Wichita, Kansas, following closely behind in the bottom 5. Residents can access the report to discover how their communities rank in terms of public green spaces, park access, recreational facilities, basketball courts, and bike lanes. Additionally, the report evaluates personal health metrics such as obesity rates, fruit and vegetable intake, mental health status, sleep quality, and smoking prevalence. A call to action for cities. Stella Volpe, president of the American College of Sports Medicine, emphasized that this report serves as a valuable resource for cities that are not performing well. It provides them with the opportunity to learn from their higher-ranking counterparts and implement changes that could enhance the health of their residents. We hope cities that don't fare as well may still be able to make some changes that help their citizens, Volpe stated. Let's just try to make our citizens as healthy as they can possibly be. Positive trends in aerobic fitness and strength. The report indicates a nationwide improvement in aerobic fitness levels. According to the Centers for Disease Control and Prevention, adults should engage in at least 150 minutes of moderate-intensity aerobic activities weekly, such as brisk walking, cycling, or mowing the lawn, along with muscle-strengthening exercises at least twice a week. In 2025, 59.9% of Americans met or exceeded these aerobic activity recommendations, marking a 9 percentage point increase from the previous year. Notably, 94 out of the 100 largest U.S. cities reported enhanced levels of aerobic activity. Furthermore, 89 cities showed improvements in both aerobic and strength-related activities. The report also noted a decline in smoking rates and an increase in funding for parks, both of which contribute positively to the overall health of urban populations. Rising food insecurity. Despite these positive trends, the report sheds light on a troubling increase in food insecurity, which has been exacerbated by inflation and the cessation of COVID-19 relief programs that previously supported struggling families. In 2025, the percentage of individuals experiencing food insecurity rose to 12.9%, up from 10.4% the previous year. Food insecurity refers to the lack of access to sufficient and safe nutritional options. Interestingly, Anchorage, Alaska, was the only city among the top 100 that did not report an increase in food insecurity. Volpe expressed concern over this rising trend, stating, "That increase in food insecurity is something to be very concerned about." Impact of policy changes on food security. The ACSM report suggests that the increase in food insecurity may be linked to the expiration of the expanded child tax credit and other food assistance programs that were implemented during the pandemic. Cindy Jordan, CEO and founder of Fittest Health, highlighted that many low-income families are struggling to afford healthy meals after losing health insurance coverage. Fittest Health collaborates with health insurance providers to facilitate access to food, transportation, and other essential services for individuals primarily on Medicare and Medicaid. During the pandemic, states paused routine eligibility checks for Medicaid to ensure that low-income families could maintain access to health care. However, the Biden administration resumed these checks nearly 2 years ago, resulting in nearly 1 in 4 Medicaid recipients who disenrolled remaining uninsured as of 2024, according to a KFF survey. The potential impact of President Donald Trump's tax cut and spending legislation could further exacerbate food insecurity, with estimates suggesting that up to 22.2 million Americans might lose some or all of their supplemental nutrition assistance program benefits. Jordan, who was not involved in the ACSM report, warned that cutting food assistance could worsen the nation's chronic disease crisis, as individuals may delay preventive care until they require emergency medical attention. If you don't eat healthy food, the cost to the health system is dramatic, she cautioned. That's exactly what we want to avoid. Air quality concerns and mental health. The report also indicates a decline in air quality across the nation over the past year. According to the ACSM's 2024 findings, residents in major cities could expect good air quality for nearly 2/3 of the days, but the 2025 report reveals that fewer than half of the days were clear. Smoke from wildfires in Canada has contributed to deteriorating air quality for millions in the Northeast and Great Lakes regions. Poor air quality can lead to respiratory issues, including coughing, wheezing, and asthma, and is linked to heart and lung diseases, as noted by the Environmental Protection Agency. The combination of worsening air quality and increasing food insecurity may have contributed to a 2% decline in the number of individuals reporting excellent or very good health. Additionally, the report tracked mental health, revealing that 44.9% of respondents reported experiencing poor mental health in the past month, a slight change from last year's figure of 44.7%. Volpe pointed out that poor mental health can hinder physical activity, which is a significant risk factor for chronic diseases. We know that physical activity improves mental health, she affirmed.